Welcome, everyone. I'm glad you could join us. My name is Arlene Goldstein, and I'm the Program Coordinator for the Blue Hills Community Health Network Alliance, known as CHNA 20. We're a nonprofit organization that serves 13 South Shore communities. We address many issues within public health. We connect and convene people. We grant make within our communities. And we help to build collaborations, to build and let people know about all the wonderful resources to improve community health in our communities. And that's why we're here today. We're here to talk with Barbara Brooks, who is from the WIC program. The WIC program is a nutritional program that Barbara and I would like to describe to you and all the wonderful attributes. WIC stands for Women, Infants, and Children. So Barbara, welcome, and thanks you for telling us all about WIC, which is such a vital resource for pregnant women and children in our communities.
It most certainly is, yes, and I'm glad to be here. Thank you. Thank you for being here and interviewing me this morning.
So let's get started. There's so much to know. What does WIC offer?
Our tagline is, interestingly enough, is good food and a whole lot more. So it's about food and it's about nutrition, but we offer lots more than that. When a pregnant woman comes in or a woman comes in with her small children, she has an appointment with a nutritionist, and at the end of that appointment, we provide her with food, not food, but cash or a card to go to the grocery store and buy healthy food. In addition to that, we talk to the families about maybe other needs they might have, such as health care or child care or fuel assistance or whatever might be difficult for them to help raise their children. We'll provide those resources as well. We keep tapped into the community, as you know, and we know a lot about resources in the community. We make sure that we are aware of new resources. We're part of the Department of Public Health, so we're also tapped into trends of things that might be a problem in the community, and we try to make sure that we're helping families in those areas. So.
It's really a wonderful resource that I think that even though it's nutrition, that people don't realize how you are able to connect them with so many of the things they need. Nutrition, of course, is so important for child development, and of course, pregnant women have, if you want a healthy child, you have to put the right things in your body to build that wonderful child. Absolutely. So who is WIC for?
So WIC is for, first of all, the pregnant woman. As soon as a woman knows she's pregnant, she can enroll in the WIC program. Even before she has a doctor's appointment, she can come in and see us. If she thinks she's pregnant, it's a presumptive pregnancy policy. It is a policy. We need to provide nutrition services and food for a woman that believes she's pregnant while she's waiting to go to the doctor. And we'll give her a little bit to get started, and we'll check in on her and make sure she's coming back for an additional appointment. We usually give her about a month's worth of food to kind of get her through until she can see her doctor. So that's the mom, the pregnant mom. When the baby's born, we're also helping mom through her postpartum time of 6 months. So that mom gets food. We want to make sure mother stays healthy so that she can then take care of her child. Especially if mom is breastfeeding, we want to make sure we're providing plenty of food. In fact, the breastfeeding package, the food package, is probably the largest package that is offered through the program. And when I say the package, we don't give the food at the program. A lot of people think we do. They actually get this food at their grocery store after the guidance.
And there's suggestive items, which we'll talk about later, which help people. It's also a learning program because people will learn about nutrition and learn about the better things to consume to have brighter, smarter, healthier children through nutrition.
Absolutely. I mean, we're teaching the mom when she comes in, and hopefully, I call it the 5-year training ground because WIC is up till age 5, and hopefully moms and dads and grandparents, anybody that's coming to that WIC appointment, because they can.
But tell us about some of the requirements, though. There are rules that need to be followed about who qualifies and who doesn't. So share that with us.
Sure. So it's for low to moderate income families. We want to make sure that families know if they're working, they're certainly eligible for WIC. It's a wellness program, really. I call it a wellness program. So people that are working hard certainly can apply for WIC. You don't have to be working to apply for WIC. There is an income guideline. A family of 4, for example, I have a family of 4. If their yearly income was $4,955 or less, they would be eligible.
$44,955, right?
Yes, yeah. What did I say? I'm sorry. So that would
Slip
be.
of the tongue.
So that would be kind of a guide. And there's we have a website. I think they'll be flashing it on the screen. The income guideline is on there. So if somebody falls through the cracks and they're kind of on the dollars away from this income. Oftentimes they're eligible for other programs such as SNAP, which is the new name for food stamps. SNAP stands for Supplemental Nutrition Assistance Program. So if they have SNAP, they're automatically eligible for WIC. We're not even looking at the income. In addition to that, if somebody has Mass Health, they're automatically eligible. We're not looking at any other documentation. We can just go with
So they can probably make an appointment, come to your office to discuss the possibility for enrollment, and you can help guide them through knowing that.
Yeah, absolutely.
And once they're there, they can probably start to apply. So how do you apply to WIC?
So it's interesting. There is no application for WIC. So applying, it's really enrolling in the program. I know we use the word or term apply, but there's no application. So it makes it simple. Sometimes we just kind of work it through on the phone. I mean, they do have to bring the documentation, but we just make sure they have, that they are a Massachusetts resident, that they have a child. They have to have documentation that they have a child.
A birth certificate, for instance.
Exactly.
And how would you prove you're a Massachusetts resident?
Usually your license, your residence is going to show that.
An electric bill, a heating bill?
Usually, yeah, your license is fine. I think a license is something that shows your residence and where you live.
Oh, okay.
Is going to be. A lot of our families don't have a license per se, and that's when they can use an electric bill if that is the only piece of paper they have. I'm trying to think of what else. So, yeah, residents. They have to be a resident. They have to have a child. They have to live in, and they have to be within the income, or they have to fall into one of the other adjunctive eligibility.
So, as you said, you don't literally give food. You're getting them set up with it looks kind of like a credit card. Why don't you explain how the payment works and what a mom would do to utilize the card at the market?
Sure. Okay. So it's a little gold card, just like a credit card or a debit card, and you use that. It's fairly new. We used to be, I think anybody that was on the WIC program years ago might remember the checks. So it's a very new thing and much easier. So you go to the supermarket and you use your card just like a debit card. You swipe it, you put your items on the belt, and they go through. And we are tied into grocery stores. So the grocery stores have an electronic connection so that they know what WIC foods are eligible or acceptable, and they use that system to kind of count the food that goes on the belt. And say if they're buying WIC food and other foods, the WIC foods get deducted using their WIC card when they swipe that, and then they just pay the difference for any other foods that they might get. So they just kind of put it all on the belt. It's simple. And
yes, nowadays with the computers at the markets, everything is kind of grouped. So when you get your receipt, you can really see, and that's a really good system. It's a private kind of a system. Yes. You can go through feeling good about it.
Yeah.
You're not singled out. There's nothing. You're de-identified.
Exactly.
You're just a shopper in the store. but you know that you're getting the best for your family, and with help.
Oh, absolutely. And the best, that is truly the best. WIC is the premier nutrition program here in Massachusetts. And I always encourage people, when you go to the supermarket now, you'll see these little purple WIC logos all along the shelves. Those identify the WIC foods.
Is that the logo that you'll see?
Yes, yeah. So that's the logo. And when you go to the
I love that sun.
So when you go to the grocery store and you see that, say under a bread or under a cereal,
right.
you know, for example, our
I have
cereals.
seen that.
Yeah. Our cereals, for example, are they have to be 6 grams of sugar or less. We don't allow anything over that as a WIC cereal. So
that's also an education of nutrition, reading those labels. Many people would really be helped by reading those labels and reducing the sugar. So what other yummy things can you buy with a WIC card?
Lots of things. All healthy, nutritional food. It is a balance of protein foods, calcium foods. Fruits and vegetables are, I can't say I would call it new anymore, but at one time WIC didn't offer fruits and vegetables. So we have fruits and vegetables available now. For a child on the program, they get $10 per month as part of the package.
Is this baby food as well, the jars of fruits and vegetables, or we're talking fresh, or both?
Yeah, so, well, a baby is a whole different package, really. They get baby food 9 months and under, they're going to be getting baby food if they want it. If a mom is breastfeeding, it's a whole different package. Then they provide the mother or the family with the fresh foods, because mom is really producing the food for the baby at that point. And so moms can buy the fresh fruits and vegetables too and make their own food. We encourage that. We've provided grinders to make baby food. But if mom can't do that, we also provide the baby food. Once a child turns 9 months old, we start with a more childlike package. So
right, because you said you can not track, but you have children up to age 5 in the program.
Yes, yeah. And it changes. When you think of a child, you know, from birth to 5, every 3 months truly changes. And they come every 3 months for their visits. So when they leave, I just want to back up, and when they leave our program, when they come into our program, first of all, they get that nutrition consultation that's free to them, you know, if they're enrolled in the program. And at the end of that, they walk out with over $180 in food benefits on their card to use over the next 3 months. And they don't have to return again for 3 months.
So there's so many benefits. You're getting that nutritional education, you're getting links to other resources in the community, you're getting financial help to put the best foods on your table, you have friendly, warm people that you go to, patient and caring, which I know for WIC is for years and years. It's such a wonderful thing, and let's not forget the dads here. So tell us about them.
Yeah, absolutely. So we have some dads that are the primary caregiver. They might be home with the child, mom is working, or mom, you know, something may have happened, and dad is the primary caregiver. And if that's the case, we provide that dad with the nutrition consult, and also with a card, and you know, he can do everything that the mom can do, you know, with regard to WIC. They're not singled out. They're not. Dads are definitely important in the whole family.
Of course.
Yeah.
What about grandparents? Sometimes we're hearing that for different social issues, grandparents are taking over care of young children. What happens there, Barbara?
Yeah, so we have some grandparents that are fostering their children. In fact, I don't know if we talked about this, but if you're a foster parent or if you're a foster grandparent, you're also automatically eligible for the WIC program. So it's important for grandparents to know if they are taking care of their children. WIC is a helpful resource, and they should reach out and touch base with us and get connected. I was talking to a grandmother yesterday on a WIC program, and we were able to help her with some additional things other than just the food. She needed some other help, and we were able to help her with that because we're very connected in the community. So yeah, dads, grandparents. Sometimes we have an aunt. Sometimes, you know, mom's in the hospital and the aunt is taking care of the child for 3 months, and aunt can come to the appointment. We just need to know, we need to have paperwork if a child's being cared for by another family member. We need to know who's truly...
WIC wants success, and that's, they're willing to go the extra mile with the client's help to do that. And WIC is so 21st century now. Tell us about that app. I was impressed by that.
Yeah, so there's an app. In fact, I'll put it up right here. This is called the Shopper app, and this is actually, I think, probably close to half the state WIC participants are using the Shopper app now, and it is not only is convenient, easy. You have to have a smartphone to use it, but most people do have a smartphone. And they basically, once they load that on and they open it up, they can put in their WIC ID number, and they can find out what foods they have available at the in their food benefits. And they can also, when they get to the store, they can scan the food with that app and find out before they get all the way up to the the register. They can find out if that's truly a WIC item that they can buy.
That is a really good thing, because sometimes you pick something up, or what I've been famous for is I look right at the item I want, and for some reason my hand goes to the thing left or right.
Yeah.
and then you get to the register and you go,
this
what?
Yeah.
So no, this is really good, because you scan it and then you drop it in your basket and you're good to go.
Exactly. When you get to the register, it's going to be accepted, and there's not going to be any embarrassment or anything like that. It's a WIC food. So. And
also, if you're shopping with your child, it's I jokingly call it's the walking time bomb in the grocery store.
Yes, it can be. So this saves time. It's easier, it's faster than any checks in the past. I know our WIC participants love it. Not all WIC participants seem to know about it, or when they get the information when they go to their WIC program. They get this little sheet here, and so they're told about it. Sometimes they might not have a phone to load it at the time, but slowly but surely, people are hopping on and getting that app on their phone and using it. So yeah, it's good. We find it very helpful for everyone.
So what else can you share about the WIC program?
Well, we recently had a farmers market coupon distribution, and that happens every year. So basically, at the distribution, this happens statewide. In our local program, we had it at our Quincy, Weymouth, Randolph, and Norwood offices. All of our WIC participants were eligible to come through and pick up coupons for the market. So those aren't your $1 coupons or $2 coupons. These were $20 coupons to use at the market. And that would be for each participant on the program. So say if mom was pregnant, she's a participant, and say she had 2 children under 5, they're participants also. That would be 3 participants. She would get $60 in coupons to use at the farmers market. So.
And were they the type of coupons that you could use over several weeks, or?
Yeah, so good question. They need to use their coupons by October 31st. Some of them save them for the the pumpkin season. They can use it for anything they couldn't use it for like a bread per se, or it really is for produce. So it's for fruits, vegetables, and fresh herbs. So anything that they would be eating, edible things from the farmer's market that are produce related. So those are the things that they could use it on. So.
And going to a farmer's market is it's a fun activity, and it's a lovely place even to take. That's a really nice place to take the children, because
absolutely,
it starts the conversations of where it really comes from and who really grew it. It's great to start to teach children to know where their food comes from, the sourcing.
Absolutely. And so when you're at the farmer's market, oftentimes the farmer himself or herself is right there. They work very hard getting this produce to the market. And you can ask them. You might see unusual fruits or vegetables that you're not used to seeing in your grocery store. And they can tell you what it is. And
how to use it.
Exactly. They have, they're farmers, but they have these amazing recipes. And they can tell you when it was picked. That's the unique thing about your farmer's market. People sometimes feel it might be a little more expensive. However, that produce is more nutrient dense than an apple that has traveled 3 days to get to the grocery store and then takes a day or two to get out.
That's the point of local, right?
As soon as it comes off the vine, it starts losing its nutrients and becoming decayed. So it's good to get it fresh right at right at the farmers market. So yeah, we encourage our families to take the children to the farmers market. A lot of farmers market now. I know that Weymouth, Quincy, Braintree, they have petting zoos or entertainment, and they do a lot of extra things.
It's an outing. It's an outing. You go for the shopping, but it's an activity, a lovely activity to share with your family.
Yeah, and it's outdoors. Children can run around.
Exactly.
Yeah.
But we just want to remind our audience that those of you who might be eligible to become part of the WIC program, that these farmers market coupons are only distributed once a year.
They are. So our distribution happened for this year, and it will happen again it's traditionally happened every year.
Put it on your iPhone calendar.
Yes, absolutely, absolutely. So when that time rolls around, they do have to be actively enrolled. They couldn't come in and say, I want to enroll in the WIC program today, and I want to get my farmers market coupons. They have to.
Right. That's what I mean, to be, once you become part of the program, to put that in as a reminder to be asking. So when are they usually offered? In June? Or you distribute them in July? When are they advertised?
Yeah, so we actually start, because we see our families every 3 months, we actually start advertising in April. So we start telling them in April to come on this date, depending on what program or what site they go to. They have to go to the site that they normally get their WIC benefits. So they are told, 3 months in advance. We give them a little reminder slip, and then they come on that day.
So when they come for their appointment, what would happen? The mom comes, the mom and the kids come, the dad comes, everybody comes?
That's a great question. And the whole family can come.
And then what would happen?
So the only ones that we really need to see is the children. We do need to see mom when she's pregnant. Of course, she's usually the one coming. We need to weigh her. We need to be assessing her weight. We don't measure her height, but we do measure the height of the children, and we weigh them. We also monitor their blood results. We're in communication with the clinicians all the time to make sure that they're not anemic, or they don't have, they're not getting exposed to too much lead. If that's the case, we're going to be trying to help that family and making sure we're following up.
And what do you use all that data for? I mean, you use it to help the family, but then when you bring all that data together, how is that used by WIC? And it's totally, that general data is totally anonymous, I would assume.
It is. And the data is not really, it's not collecting, the information, that data is really not collected. I mean, we're aware of it, but the data is really for the family and the child.
Okay.
We're part of the Department of Public Health. First and foremost, we're there to make sure that children are healthy and that they aren't falling through the cracks and they're getting their needs met. And we're helping families. We're that safety net for young parents it's a struggle. You know what I mean? It's not always easy childcare is very expensive. And you've got all these needs when your children are young like that. When they go off to school, it's a little bit different. Things change and you can maybe get back into the workforce, but it's hard, and we're there.
Right, I know that WIC works closely with Head Start programs and things like that, and as you referred to, issues with housing, and even if you discover that there's lead paint in where you're living, this is why WIC is such a wonderful resource.
Yeah, we would definitely try and refer. We're pretty tapped into the community. We know of resources. If we don't know of a resource and we have a concern, or a family has a concern and they're reporting that to us about health or the well-being, we'll reach out to our state WIC office and ask them for resources. And we've done that before to make sure that our communities are getting what they need.
So what's the last thing you'd like to share about WIC?
Let's see. I'm trying to think of one of the new things that we're doing at our WIC program this summer is the Summer Food Service Program, which is through the public school. It's also through USDA, which is we're part of USDA. So this is free lunch offered at our WIC program on Wednesdays for the children.
And we haven't mentioned where exactly WIC is.
So we have 5 sites, and those can be found on our website, which is quincywic.org. And I think they'll be putting that up on the screen as well. But we have our main office here in Quincy. It's across from the old Quincy Medical Center on Whitwell Street. And we're open Monday through Friday. And in September we'll be open some Saturdays. So we have evening hours as well. And so that's our Quincy main office. We also have another site inside of South Cove Health Center, which is North Quincy. We have an office in Randolph, right on Main Street. We have an office in Weymouth, on Athens Street inside the Pilgrim Church, and we also have an office in Norwood. So we're all over locally, but there's WIC programs all across the state. I think there's over 100 well over 100 sites.
So you have a lot of crossover with the service area for Chinna 20, the Blue Hills Community Health Network Alliance.
Yeah.
So I hope everyone out there has learned a great deal about WIC. It's a superb resource with superb people who care about community members and want to see only the best for pregnant women, children, and infants and their families. So thank you for joining us, and see you next time.